Hi, I'm Dr. Chuck with Your Filthy Mouth. We talk a lot about the teeth and the gums, but we don't talk that much about the tongue. Let's talk about the tongue today. Stay tuned.
Your smile is beautiful and possibly deadly. Dr. Chuck is here to tell you how your mouth can hold the key to your overall health. Now, about that filthy mouth of yours.
Hello and welcome to Your Filthy Mouth. Suzanne Lynn here with Dr. Chuck. And today is a show kind of like we've never done before. This one is really a little bit different because we're going to be focusing specifically on the tongue.
The tongue is part of your mouth, and it's a part that your parents tell you, you don't stick out your tongue.
Right,
right. But
right.
The tongue is really important. We use it for speech, we use it for swallowing, we use it for a lot of different things. Mm-hmm. And bacteria use it for a hiding place, too. So on the top of your tongue, you have all those, it's called filiform papillae. It looks like little hair-like structures on there. And bacteria go from the teeth onto the tongue, and they just love to hide under the tongue right there. So that's another thing. You don't want to, when you clean your mouth, you don't want to just redistribute the bacteria. You want to get them out of there. So when you're cleaning your mouth, you want to clean your tongue as well with either tongue scraper or brushing your tongue. But there's so much more than just the bacteria on the tongue that we're going to talk about today.
So one of the things that kind of inspired the show is a friend of mine. Her husband was diagnosed with cancer on the tongue, and don't want to scare anybody, but I mean it was relatively fast that he was diagnosed with that. But before the dentist found the spot on his tongue, a couple of years before that, there were like little white spots on his tongue. So I mean, can you kind of walk us through this? What does cancer look like? You know?
That's a really good question. What does it look like? Well, it can be white, it can be red, it can be raised, it can be flat, it can be regular, it can be irregular. The fact is you don't know whether it's cancer or not until you biopsy it, and then you have to find out. So the way we do it in our office is we do a thorough examination, just visual, and also we use a special light called Velscope, and you're able to see where the cells in a particular area are multiplying faster than the cells around them. So it could be an area that's healing up, and it shows up under that.
Okay.
In a couple of weeks, it's going to be gone. Or it could be an area that shows up in a couple of weeks, it's still there. And then we need to get that checked out. So a lot of times we'll refer to an oral surgeon. They'll do a biopsy and find out whether it's cancerous or something else.
I'm sorry, I didn't mean to interrupt you. I was going to say, do you see a lot of tongue cancer in your practice?
Usually we'll find it once or twice a year, but so far this year we found it 3 times.
Okay, and you have lots and lots of patients. So
this is not a common thing you're going to find. No, it's unusual. But you want to find it small. That's the whole idea. Oral cancer is if you have the surgery, it's very disfiguring. It's absolutely no fun. So the smaller you can detect it, the better it is for everybody.
I guess this seems like an obvious question, but for especially the guys that put tobacco under their tongue, I mean, that's probably not just causing some health issues, but don't you think it's probably affecting their taste, right, and taste buds?
Well, when you're using smokeless tobacco, it increases the risks of getting oral cancer. And so it is, you've got different chemicals that are not supposed to be against the tissues like that. And sometimes you have what's called a precancerous lesion. You look inside, you see these white patches, you see kind of wrinkly on the side. That doesn't mean it's cancer. It means that tissue is much more susceptible at becoming cancer.
Okay.
And so that's reversible. If you can just stop it. I had a young man, when I looked in the corner of his mouth and I saw these white patches going down there, I said, "You still dipping?" He goes, "Yeah." I said, "So how old are your 2 boys?" "Oh, they're 6 and 3. I said, "Do you think they need a dad?"
Wow.
And boy, it was like I hit him, pow.
Yeah.
And he quit.
Yeah.
I mean, just like that. He said, "This is not anything to play with." But
Wow.
it's tough. I mean, it's like giving up smoking. You get addicted to it. It's not telling people how easy it is, but it's really important. Oral cancer could come if you're not a smoker, if you don't dip. So this is why oral examinations, oral cancer examinations, are so important.
So I'm still teary. You loved him enough, you cared enough to be honest with him, and I think that that's really important, not just dentists, but all physicians, to really hit home with health.
It doesn't stop with the individual. When one person in the family has a health issue, whether it be a heart attack, a stroke, oral cancer, any type of cancer, it affects the whole family. So these are tragedies that are preventable. So I don't focus on what we can't do, but let's focus on what we can do. And
Whack! Stop.
there you
Well,
go.
it worked.
Yeah.
And that's what matters.
Yeah.
Those two boys will be thanking you.
Well, that's they need a dad.
Yeah.
They need a dad.
So other things with the tongue, I've heard you talk about that. Sometimes people can have a thick tongue and it affects their breathing. Can we talk about that?
Thick tongue, and I've had some people say, I can stick out my tongue and touch my nose, and so that's easy. Just
You set me up. Set me up.
But yeah, you can get a big thick tongue in there, and that can be an airway concern. Not saying it's a problem. You have to sometimes be diagnosed whether you have that sleep apnea or a problem like that. But yeah, your tongue can be an issue like that. A lot of times we can look inside and look on the side of a tongue, and if it looks, they call it a scalloped border. If the sides of the tongue looks like they're scalloped going in, many times that's the tongue trying to push the jaw forward at night when you're sleeping to try and open up the airway. So when you see a scalloped tongue, that's kind of a red flag to say, what's going on here? And sometimes that is just an indicator that there could be an airway issue going on. So there's a lot of things to look at the tongue. And another thing you can see sometimes people, they call it black hairy tongue. And those filiform papillae, those hair-like structures I was talking about.
So you're saying there's hair on your tongue?
No. They look like hair. It's not hair.
Okay.
They're filiform papillae, which is one of our instructors was very clear about saying it's not hair.
Okay, all right.
It's okay, but they're little structures that they get taste and everything that goes with them.
Like little feelers.
Yeah, they can get stained depending on what you're eating. It'll pick up the stain. When I was in dental school, we had a patient come in, and her tongue was red. And students looked at it and said, oh my gosh, what is this? They called a couple of instructors in. They looked at it and said, oh my gosh, what is this? They called one of the older oral diagnostic geniuses in and said, it was happy Dr. Harold Stanley. I still remember him. He says, Dr. Stanley, would you take a look at this and see what this? He looked at it and says, do you suck on, and it was a particular type of mint or something.
Oh.
And she goes, oh, yeah. He goes, that's what it is. Oh. So just because you see something discolored doesn't mean it's a bad thing. But you need to find out why is it that color and what's going on. A lot of times tobacco, heavy smokers, they'll have a black tongue. And so, again, that's not going to kill you, but it's an indication that you're doing something maybe that you shouldn't be doing so much of. So.
What are some other things tongue-related that we need to know about?
Well, speech is a real important thing on that. But the main thing is you want to make sure it's clean. Make sure that you can clean your tongue. You don't have the scallop borders going around it. And especially you don't have anything growing on there that you don't know what it is. I've seen patients in the past, how you'll get your piercings in different places. I've seen them actually split the tongue down the middle to be like a snake-type tongue. It's unusual things, but people do unusual things to their bodies. Tongue piercings, that's not a good idea. Because if you pierce the tongue and you've got that metal stud in there, that can mess up the gums that you have around the inside of those lower front teeth. And if you bite on it, you're going to break some teeth. So, those are the things, just don't do it.
Just don't do it.
Yeah.
All right, we're going to come back with the question of the week.
Here's Dr. Chuck's question of the week.
Hey, this is Melissa. I have really ugly teeth, but my parents had bad teeth too. Is it possible I just inherited bad teeth and that there's nothing I can do about it anyway?
Good one. That's a really good. I'd like to blame my weight on my parents too, but I'm not so sure we can just pass everything off on genetics, right?
No. Just because your parents have bad teeth doesn't mean you're going to have bad teeth. There are certain things that you inherited from your parents way besides genetics. One of the things you inherited is lifestyle. But that's something you can change. If your parents didn't take care of their teeth, you might not take care of your teeth, and you're going to have the same issues. Taking care of your teeth means a whole lot more than just putting a toothbrush in your mouth once in a while. You really have to focus on that. But it's so easy to blame genetics, to blame, this is what my whole family has this. You're the one that can break the cycle. You're the one that can say, look, it's not going to go any further. Me and my kids are not going to have this issue. We're going to take care of our mouths. And that doesn't mean a Hollywood smile, but it means no infections. Spending that 5 to 7 minutes one time a day, get in there and really clean. Use disclosing tablets. Again, if you take a test and it's never graded, how do you know how well you did? So the good news is, just because your parents have bad teeth No, that doesn't mean you're going to have bad teeth. Now, there are some times that you took medications as a child, and that's going to stain your teeth as an adult, but that doesn't mean they're going to be bad teeth. That just means they can be stained. So, spend that time and break the cycle. Be the first one in your family to break the cycle.
You know, one of the things I'm thinking, we actually did a show, Lifestyle versus Genetics, and you can find that at yourfilthymouth.com. Maybe that's something to kind of dive into a little bit more, but it's good.
Yeah.
Good answer. So let's kind of wrap up what we need to know about the tongue, and it's about so much more than just that it's there for us to taste.
Yeah,
You know?
speech, is a big deal with the tongue, but you want to make sure you have a healthy tongue. And how do you do that? Well, you can stick it out and look at it. I mean, your mom told you don't stick out your tongue. Well,
Right.
stick out your tongue. Look in the mirror. Pull it out and see what's going on. If you see anything growing on the side, any little areas that might be round, it might be irregular, it could be a different color, check it out. Look at it in a couple of weeks. Is it still there? No, it went away. Okay, it could have been something else. There's something called benign migratory glossitis, which is geographic tongue. You get these areas that kind of move all over your tongue. It's benign. It doesn't do anything, but you want to find out. You want to know. Because if it's not benign, the sooner you diagnose it, the sooner you get treatment, the less horrible results you're going to have afterwards. It's no fun if you have to have major surgery and have your tongue removed.
Oh, wow.
Yeah.
Yeah. Okay. Well, I mean, it's a big part of the mouth, you know? So.
It's a huge part, Personally, I think Jesus was a dentist.
You do.
He spends more time talking about controlling your tongue than he talks about murder.
I can't top that one. I'm not even going to try. Thank you for joining us. Be sure to subscribe so you don't miss any more of this amazing wisdom and information, and share with your friends and
please
coworkers and everything. That's so important. And if you're in Central Florida, Dr. Chuck would be very happy to have you in his chair. Yeah. Thank you again for this episode of Your Filthy Mouth.
This has been Your Filthy Mouth, a weekly podcast about how what happens in your mouth affects the rest of your body. This is important information, so please share it with your friends. Don't forget to hit the subscribe button on YouTube, iTunes, and all the other podcast sites. And drop by yourfilthymouth.com to ask Dr. Chuck a question or find dozens of links to information about oral systemic health. We'll talk to you next week.